I know every community does, but Black and Brown communities, hands down, experience more of the childhood traumas that unfortunately we carry into adulthood. And generationally, we also have to look at those genetic links between certain mental health conditions. I know that my children are more likely, because of my diagnosis, to also have their own struggles with mental health. So I think the first thing is us having awareness, or raising our awareness, if that may be the case, about the full spectrum of mental health. And like you said, it's not about those who are diagnosed versus undiagnosed, those who have a condition and those who don't. It really is a continuum. If we live long enough, we're going to experience stress and challenges, and good and bad. Our mental health hinges upon how we respond. When we are constantly taxed and stressed, physiologically, it ages us. Physiologically, it changes structures in our brains that can shorten our lifespan. It can shorten our ability in terms of our brains to function later on in life. And so when we think about starting now to break those cycles, it starts with reaching out to those closest to you. So as a parent, I openly shared with my oldest, who's 20, when I thought she was age appropriate, to let her know these are things I struggled with. I was educated on what are those signs and symptoms. And when I saw something that didn't sit right, I went to her as opposed to waiting for her to come to me. And even those small things, that they opened and laid a foundation for her to know, I can talk to my mom. If my mom is asking me about these, even if I'm not having any issues at the moment, she's opened the door that should I begin to have issues and should I begin to have struggles, I can come to her. And those seeds that I laid when she was around 10 are paying off now that she's 20. And I can hear her talk about her she calls it her social and emotional thermometer. And she'll say, well, Mom, my social thermometer right now is a little low, so I'm not going to go hang out with her friends. And I almost want to cry, because I'm like, wow, that level of emotional intelligence, I wish I had when I was 20.
You can take credit though.
Right. And so I can see that now when she starts to have a family, I've laid a seed that it won't be the same as when I was growing up. To my twin, who she will be 9 soon. She came to me maybe about a year ago, and she was like, Mom, can I talk to you? I'm like, sure. She was like, I'm feeling really emotional. I was like, okay. I was like, well, can you explain? I said, is it a good emotion? Is it a bad emotion? And she was like, I'm not sure. She's like, but I feel sad and I don't know why. I said, okay. So I let her talk and express as best she could what she was feeling sad about. And we kind of rested on that. I think it was a little bit of angst with some issues with the girls in her class and some other, nothing life shattering, obviously, for me at my age, but for her at 8, I'm like, that's a big deal. And it's those things, I think, for us to generationally, it's for my generation and even the generation before me, of realizing that our children are growing up in a different age and a different society. They are going to require things from us that we probably didn't get. And so going to find those resources, to find those places to get educated on recognizing what signs and symptoms look like of chronic stress, of fatigue, of anxiety, of depression. That's where we have to start, so that we can see it not only in ourselves, but we can see it in those around us. And because I think without that, I can't create that safe space, because I don't know I need to create it. And that's how I think we begin to generationally change and stem the tide, is by looking at, again, not just my children. I'll do this with any other young people that I have an opportunity to be around. My daughter's friends will call me and we'll talk, or they'll ask a question and I'm like, sure. So it's wherever and whoever you touch, it's about, can I lay a seed here to make you aware of this issue, or make you aware of this challenge, and aware of what is available, because that's also something we don't do. There are tons and tons of resources, not everything we need, but there are resources. There's mental health first aid that is available through organizations like Mental Health America. So you can go and get trained on mental health first aid, just like we do CPR. So to save a heart, to keep a heart beating, we can also learn, well, what do I need to mentally keep going? And those are available in our communities right now. Finding out where support groups are. They exist. You maybe have to dig for them, but I think we've got to see, where can I make those investments to get myself educated so that I can not make the same mistakes of our previous generations.